Now, we've all heard about the dangerous effects of smoking, but seeing its long-term damaging effects was once impossible.
CBS 19 has discovered a new software program aimed at kicking butts by giving kids a look at their future face if they smoke. CBS 19 reporter Jane Slater has tonight's special report. Jane?
Well, someone just died of tobacco-related death. That's right. Statistics show it's every 10 seconds. But despite overwhelming mortality rates associated with lighting up, doctors say kids aren't getting the message. But a new computer program called Aprilage helped get 6 Tyler kids' attention. Now, we must warn you, some of these images are graphic.
It's tragic.
Anti-smoking advocates have long relied on shocking images to get their point across, particularly images of cancer-ravaged patients.
I show him this. It's one of my patients that lost his lip.
So that's a real patient?
He's a real patient.
But snapshots of these 4th and 5th graders aged 60 years in a matter of seconds,
that's what you look like as a smoker.
Oh my gosh.
is what really sent the Just Say No message home.
That's just unbelievable. The difference is just huge.
Now that's you if you smoke. That's you if you don't smoke.
I'm not smoking. I don't want to smoke, because if I do, it's going to look scary.
6 students in grades 4 and 5 participated in our report. We took each of their pictures and scanned it in the Aprilage program. In less than a minute, we were able to show each of them their future face if they smoked.
I don't like the one where I smoked. It is very, very ugly.
That's what you look like at 72. What do you think of that?
Yeah, I'm not going to do that. I'm never going to smoke.
They're all so young.
Dr. Heidi McKellar with the East Texas Medical Center Cancer Institute couldn't believe her eyes.
Oh my goodness.
While McKellar wasn't familiar with the Aprilage program, she applauds what it does.
I always said if I can't appeal to your sense of health, then maybe I can appeal to your sense of vanity.
McKellar says no matter how the kids get the message, they need to know the dangers of smoking.
Kids get addicted to cigarettes just like that, and they're designed to do that. Once you're on them, they're not going to be able to stop doing it. And then once it's too late, it takes years for them to actually be able to stop.
That's why we chose 4th and 5th graders. Smoking continues to appeal to a younger target audience. But after seeing these pics,
How do you feel about smoking now that you've seen, the possible effects of smoking?
I don't want to do it.
these kids say they're not interested. And the program got a thumbs up from 10-year-old Carter Sirianni.
I think that the program will help kids learn how not to smoke, and it'll teach them that smoking is bad for you and you shouldn't smoke.
To learn more about the Aprilage software, you can visit their website at www.aprilage.com. The smoking progression software does cost, but you can try the free sample version by clicking on the April in Action icon. And guys, we really want to thank the kids and staff at East Texas Christian Academy for their participation in our report. We had a lot of fun.
If that software doesn't catch their attention, I don't know what will.
I don't either. It was pretty shocking.
Very eye-opening. All right, Jane,
Thanks, Jane.
thank you. Well, in our studio right now to talk about the effects of smoking and the story you just saw is Dr. Heidi McKellar, a radiation oncologist with the ETMC Cancer Institute. Dr. McKellar, thanks for being here. In your opinion, how effective is the Aprilage software?
Well, I was at the East Texas Christian Academy today, and I think from the responses that the kids gave you, you can pretty much see how effective it is. I show a lot of graphic pictures in some presentations I give at school. I don't actually show the children aging, and I think when they see what happens to them as an individual if they smoke, it's pretty compelling.
Now, you talk to school kids all the time about the dangers of smoking. How hard are they to reach?
It really depends on the age. I found that kids now, you have to reach them in the 4th and 5th grade level because that's when they're starting to be approached about smoking. But I think that this program would probably be very, very helpful in teenagers that are already smoking because I think probably you could get some of them to stop based on what they project themselves to look like.
Dr. McKellar, we appreciate your time today. Thank you very much. I know it's a big job you have trying to discourage these kids from smoking. Thank you for being here.
Thanks.